Hi everyone, this is AP Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today we are going to discuss previous year questions of ENT. Exam is Neet Pg, year is 2020. So आज हम क्या करने वाले हैं? हम प्रीवियस ईयर क्वेश्चन डिस्कस करने वाले हैं। किसके? ENT के एग्जाम कौन सा है? नीट पीजी ईयर कौन सा है? 2020. Okay, so before starting our today's discussion of previous year question, I want to request all those who are new to my channel, my dear friends, please subscribe to my channel and press on notification bell icon so that you can get updates for all important upcoming videos. Okay, so let's start our today's discussion. First question: note a landmark of facial nerve identification in a parotid surgery. Options are inferior belly of ophthalmic, peripheral branches, posterior belly of digastric, tragal pointer. So my dear friends, correct choice for this question is inferior belly of ophthalmic. Okay, और अगर अब एक पॉइंट और बोलता हूँ, now I am saying a point that if you are not reading the question carefully, then you will do a silly mistake. Okay, what silly mistake students generally do? Students क्या silly mistake करते हैं? वो रीड नहीं करते हैं क्वेश्चन को केयरफुली, वो नोट को मिस कर देते हैं. ठीक है, क्वेश्चन के एंड में होता है एक्सेप्ट. ओके, एग्जामिनर से एक्सेप्ट ऑफ द फॉलोइंग विच इज false, which is true. Okay, so student not read question carefully and they get easy question incorrect. Okay, so आसान सा क्वेश्चन गलत कर देते हैं. So the questioner is asking not a landmark of facial nerve surgery. Okay, so facial nerve identification in parotid surgery, so not a, so it's incorrect choice. Okay, so here according to examiner it's correct, but it's not a landmark. Okay, what is next? Peripheral branches. Yes, it is a landmark. Posterior belly of digastric. Yes, it is also a landmark of facial nerve. And tragal pointer. Yes. So here in one line you all see the landmarks: cartilaginous pointer, phaenomastoid suture, styloid process, and posterior belly of digastric. All these are landmarks of facial nerve identification in parotid surgery. Okay, so first question is clear. Let's move to next question. A 3-year-old boy presented with fever. Okay, so read the question carefully. A 3-year-old boy presented with fever, pain in throat, okay, and difficulty in deglutition. Okay, and on examination you will see below finding what is the best diagnosis. Okay, so you see options here and the finding is in image. So this is the image. What do you think? See this image carefully. Okay, from here I am giving you little hint. If you are able to diagnose, then you can diagnose it very easily by image. The age is 3-year-old. Okay, so the correct choice for this question is, what do you think? What is the correct choice? The correct choice for this question is peritonsillar abscess. Okay, correct choice क्या है? Peritonsillar abscess. Okay, so let's see the picture of peritonsillar. Okay, we see this image in detail. Okay, peritonsillar abscess. What is this peritonsillar abscess? First thing, if I tell you, this is a pus. Okay, which form behind the tonsil. Okay, जो tonsil के पीछे इन्फेक्शन होता है. ठीक है, इन्फेक्शन होने के बाद वहां पर पस फॉर्म इकट्ठी होती है. ठीक है, वो जो जनरेशन करती है, जनरेट जो करती है, वो क्या है? पेरिटोन्सिलर abscess. Okay, so there is an infection behind the tonsil which will lead to formation of pus, and this pus will form an abscess, that is peritonsillar abscess. Okay, so here you see the image. It is an image for peritonsillar abscess. Okay, both radiographic and okay, here it is an CT imaging for a person. Here it is, you are seeing the normal. Okay, so peritonsillar abscess is also called as quinsy. Okay, what is also called as peritonsillar abscess is also called as quinsy. And another important thing is that in this case you will see muffled hot potato voice. Okay, so this is clear. What is next thing? Here also another image for peritonsillar space. Okay, here you can see the one of the option retropharyngeal abscess. Okay, so this is retropharyngeal abscess. Here it is an alar fascia, and here you can see it is case of peritonsillar abscess. So the detail image is here. Okay, so what is a next case? Next question. Occipitomental view with open mouth as shown in image is also known as. Okay, so you can see here the open mouth. Okay, so clearly you can see. Now you have to tell what is this. Okay, Cadwell view, water view, pyrie view, or none of the above. So, my dear friends, correct choice for this question is Pyrie's view. Okay. So, generally occipitomental view. If examiner only see occipitomental view, okay, is known as. Okay, then the choice for this question will be वाटर्स व्यू. अगर एग्जामिनर बोल रहा है ओसिपिटोमेंटल व्यू ओनली, ओके, तब तो आंसर क्या होगा वाटर्स व्यू. बट एग्जामिनर ने क्या बोला है ओसिपिटोमेंटल व्यू विद ओपन माउथ एज सोन इन इमेज इज आल्सो नोन एज पायरीज व्यू. ओके, सो ओपन माउथ जो ऐड किया है उसकी वजह से इसका आंसर क्या है पायरीज व्यू. ओके, व्हाट इज नेक्स्ट क्वेश्चन? A patient presented with road traffic accident and image is shown. Okay, yellow image. What you will call this finding? Okay, so you can see here and you have to diagnose that what is this. Battle sign, basalt abscess, Grisner sign, none of the above. So my dear friends, correct choice for this question is battle sign. Correct choice क्या है battle sign. So second option was basalt abscess. Okay, when the basalt abscess will form and when the battle sign will seen. Okay, so battle sign, it is an hematoma over mastoid during the fracture of midcranial fossa. Okay, and temporal bone fracture, hearing loss, ear bleeding, raccoon eyes, and or brushing over mastoid cortex. These all things we can see during battle sign. Okay, so here it is an redness over the ear. Okay, so it is also said as battle sign. basalt sign कब होगा जब मेस्टोइड से अपर नेक में ट्रेवल करेगा. ठीक है, जब मेस्टोइड से अपर नेक के मसल में जब ट्रेवल कर जाएगा जो पेन है, ठीक है, या फिर जो इलनेस है, वो जब मेस्टोइड से अपर नेक के मसल में ट्रेवल कर जाएगा. स्टर्नोक्लीडोमेस्टोइड मसल. ओके, देन दैट इज basalt abscess. Okay, so it is an muscle for upper neck area. Okay, this question is also clear. Next question. Cuff reflex on scratching the floor of external auditory meatus is due to which nerve? Okay, so auricular branch of vagus, facial nerve, auriculotemporal, greater auricular nerve. Okay, so the correct choice for this question is auricular branch of vagus. Okay, cuff reflex on scratching. अब एक अनदर क्वेश्चन यहाँ पर खड़ा हो गया कि अगर स्क्रैचिंग की जगह साइरेंजिंग होता. ओके, इफ इन द प्लेस ऑफ स्क्रैचिंग आई प्लेस साइरेंजिंग. ओके, कफ रिफ्लेक्स ऑन सिरिंजिंग द फ्लोर ऑफ एक्सटर्नल ऑडिटरी मीटस इज ड्यू टू विच नर्व? एंड द आंसर फॉर दिस दैट इज आर्नोल्ड. ओके, आर्नोल्ड नर्व. ओके, सो स्क्रैचिंग की जगह सिर्फ सिरिंजिंग प्लेस करना है तो आंसर क्या हो जाएगा आर्नोल्ड नर्व. और क्रेनियल नर्व कौन सी है 10. So Arnold cranial nerve 10 and it is an antero-inferior area. Okay, and if the area is posterior-inferior, that is C3 spinal nerve. Okay, so if we tell about nerve supply for external auditory meatus. Okay, so अगर external auditory meatus की nerve supply की बात करें तो फेशियल नर्व है वो पोस्टेरियो सुपीरियर होगी. ओरिकुलो टेम्पोरल नर्व वो क्रेनियल नर्व 5 एंटीरो सुपीरियर एरिया. ओके, एंड पोस्टीरियो इंफीरियर एरिया में कौन सी है C3 स्पाइनल नर्व. एंटीरो इंफीरियर में कौन है? एर्नोल्ड नर्व. ओके, सो एंटीरियो इंफीरियर, एंटीरियो सुपीरियर, here both are. Okay, that is temporal C5, and Arnold nerve, that is antero inferior nerve. Okay, and posterior superior, posterior inferior. So nerve supply of EAM or external auditory meatus is also clear from this question. What is next question? Left recurrent laryngeal nerve has a longer course because of which artery? Okay, first arc, second arc, third arc, sixth arc. So the correct choice for this question is sixth arc. Okay, so left recurrent laryngeal nerve has a longer course because of which arc of artery? That is sixth arc of artery. Okay, what is next question? Tuberculosis otitis media of middle ear has all of the following except. So the options are multiple perforation seen in tympanic membrane. Okay, painful otitis otorrhea is seen, pale granuloma are seen, ATT used primary. Okay, so what is exception here? Which all are correct and which is wrong? Okay, so the correct choice for this question is painful otorrhea is seen. So यहाँ पर क्या सीन होता है फिर? My dear friends, here we will see only foully smell otorrhea, not painful. Okay, so that's why it is wrong here. All others are correct. We can see multiple perforation in tympanic membrane. We will see pale granulomas, and we will also use ATT during primary treatment for tuberculosis otitis media. What is next question? A 70-year-old patient presented with history of fever, repeated aspiration and coughing in night. On examination, there is swelling on left side of neck which produce gurgling sound, and on compression, shown is barium swallow case of patient. Clear the diagnosis. So, if you see this image, uh, and if you are well known with the radiology, then you can easily diagnose this thing. What do you think? What is this? So the answer, or you can say the correct option will be, my dear friends, the correct choice for this question will be Janker's diverticulum. Correct choice क्या होगी? Janker's diverticulum. Okay. So what is next? Partial closure of nose is done by which condition? Partial closure of nose is done by which condition? Options are allergic rhinitis, atrophic rhinitis, vasomotor rhinitis, occupational rhinitis. So my dear friends, correct choice for this question will be atrophic rhinitis. Why it is correct choice? So my dear friends, what happen in atrophic rhinitis? होता क्या है atrophic rhinitis में? During this, there is occurrence of atrophy of nasal mucosa again and again. Okay, you can say recurrent occurrence of atrophy of mucosa of nasal. Okay, nasal area, nasal mucosa, nasal जो mucosa उसका atrophy again and again होता है, recurrent atrophy, and that will relate to obstruction of, or you can say partial closure of nose. Okay, that will lead to obstruction of nose. Okay, by continuously atrophy there will be breakdown of bones. Okay, and the mucosa will get scattered, and that will lead to obstruction for the nose. So the correct choice will be atrophic rhinitis. Okay, what is, so my dear friends, our last question for the day is surgery to widen cartilaginous part of external auditory canal. Okay, क्या surgery है? To widen the cartilaginous part of external auditory canal. So it is meningeoplasty, it is meatoplasty, it is otoplasty, or it is tympanoplasty. So my dear friends, correct choice for this question will be meatoplasty. Okay, what is meatoplasty? It is a surgery which is generally used to widen the cartilaginous part of external auditory canal. Okay, what are the another options? Meningeoplasty. What is meningeoplasty? It is generally a process of surgery which is used for repairing perforation of tympanic membrane. Okay, so repair of perforation of tympanic membrane, that is meningioplasty. Okay, what is next? Otoplasty. What is otoplasty? Otoplasty, it is reconstruction of ear pinna by surgical process. Okay, what is tympanoplasty? Tympanoplasty, it is a process which is generally used for reconstruction with meningioplasty. Okay, so tympanoplasty is used with meningioplasty for tympanomembrane. Okay, tympanic part of ear. Okay, tympanic membrane. Okay, so it is generally used for reconstruction with meningioplasty. Okay, so my dear friends, this is about 2020 ENT question. Thanks to everyone for watching this video. My dear friends, my intention is only to share the previous year question of ENT which come in past 2020. Okay, so all these are previous year questions for ENT. Hope you all feel these are helpful, and these will surely help in your upcoming exam. So my dear friends, if you feel that these are helpful, then my dear friends, please share this question with your friends, and also say them to subscribe to my channel. And if you are new to my channel, my dear friends, please subscribe to my channel and also press on notification bell icon. And if you want to practice other questions, mixed bag question and previous year question of other subject too, okay, then you can get a link of complete playlist in end of this video and also in description of my video. Okay, so thanks to everyone, stay safe, stay healthy.